Story 1. During a surgery residency trauma call, a prisoner came in after a fight and claimed he could not move or feel his legs. All computed tomography scans and magnetic resonance imaging studies were normal. We shielded his legs so he could not see them and poked them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with spinal cord injury without radiographic abnormality. He stayed in the hospital for a week with no improvement and always had one guard with him. One night they were in the lobby watching television, but the guard needed to use the restroom. The patient said that he could not possibly go anywhere because he was paralyzed. The guard left him alone for 2 minutes. The patient was last seen sprinting down the road naked. He made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. He was truly playing the long con. Story 2. I am a dermatologist. A patient was convinced she had a melanoma and insisted she needed a biopsy and to be placed on workers' compensation. I told her it looked like marker ink. I wiped the area with an alcohol swab and showed her the ink, demonstrating there was no lesion on her skin. She stormed out threatening to sue. I am just glad I cured her melanoma. Story 3. A patient came in after a fall who could not move their legs at all. I conducted multiple tests and found nothing abnormal. The patient was not at all disturbed by suddenly being paralyzed, which was the first warning sign. I did not initially believe anything was wrong, but the patient still could not move their legs. My options were to admit the patient for an extensive workup or to attempt to get them to walk. I told the patient that all tests were normal and that they could go home. The patient got up, dressed, and walked out without a word. Story 4. I am not a doctor, but I worked in healthcare for nearly 20 years. While taking a break from the intensive care unit because it was emotionally draining, I worked in home health for a while. I had a patient who clearly had Munchausen syndrome. On a daily basis, she would call her insurance to see what things would be covered if she was diagnosed with one condition or another. She called her doctor's office an average of 5 times during my shift with her and reported all kinds of unreal symptoms. She pressured doctors into performing exploitative laparoscopic surgery. Of course, nothing was found. One day I walked in and she was rubbing her incisions with rotten cabbage in an apparent attempt to cause an infection. She was not seeking pain medication except to sell it. She was just as satisfied with antibiotics or stool softeners, anything, as long as she received a prescription and could go to the pharmacy, where she would put on an elaborate routine claiming allergies and adverse reactions. She constantly increased the exaggeration of her stories. Once she fluttered her eyes after making sure I was watching and claimed she had lost consciousness for half a second. She told the doctor it was 5 minutes. She told the insurer it was 10 minutes. She told the pharmacy it was 30 minutes. Then she called emergency services and said she had woken up on the floor after losing consciousness for 4 hours. The worst thing was that she was a mother. Her son was 28 at the time, and from all the stories about his childhood illnesses and her insistence that he was severely disabled, I knew she had basically ruined his childhood with Munchausen by proxy. She portrayed him as severely disabled and claimed he would never find a wife. I met him. He was healthy and of average intelligence. He was not looking for a wife. He was gay, but she refused to accept that. Working with her was so miserable that I took a couple of years off from healthcare afterward. Story 5. We had a patient faking a seizure. My supervisor told a staff member to get the brain needle. The patient made a swift and miraculous recovery without intervention. Story 6. A young woman, about 18 to 20 years old, ran into a small rural hospital emergency department, pretending to have abdominal pain. A police officer had tagged her for driving more than 40 kilometers per hour over the limit, which qualified as stunt driving under the new Ontario law, with automatic vehicle impoundment and license suspension. The police officer followed her into the emergency department and said he would be waiting for her when she left. Locum tenens staff such as myself were housed at a small bed and breakfast about 15 minutes away, and the emergency department had pre-printed order sets to be completed before we arrived. When I arrived, she admitted she had come in because she panicked and had not stopped. I told her we would give her 45 minutes to call her parents or family before I discharged her. A beta human chorionic gonadotropin test was positive, and subsequent ultrasound showed an extremely early ectopic pregnancy. The police officer realized something was wrong when he heard an air ambulance call over the radio. She was completely asymptomatic and had inadvertently avoided both the driving charges and a life-threatening condition. It was a shocking moment. A little more information. Small rural hospitals in northern Ontario often serve areas more than an hour's drive away, while having catchment populations of only 2,000 to 3,000 people. When on call, we would do daytime work in the community clinic, then hospital rounds, then go home and remain on call. We were not based at the hospital because there was no on-call room. Many nights passed without being woken, or we might get a single call from the acute care inpatient unit. Locum tenens positions are short-term contracts for places without full-time medical staff. It is hard to attract clinicians when the community lacks broadband internet. These positions generally pay very well. Story 7. I am a pediatric neuropsychologist. I received a referral to consolidate his care. The patient was a 13-year-old who was wheelchair-bound, required therapeutic oxygen, had seizures, arthritis, and other musculoskeletal problems, suspected autism, was completely nonverbal, and had severe behavior challenges. He was followed by at least 8 different specialties, and none were communicating with each other. His medication list contained approximately 18 prescriptions, including potent opioids, antipsychotics, and antiepileptics. He was referred to me after another visit to the emergency department because that clinician felt something was off and he needed someone to look at the whole picture. The working diagnosis was factitious disorder imposed on another, also known as Munchausen syndrome by proxy. All of the original symptoms were reported by the caregiver, going back to about 1 year of age. It possibly began with a febrile seizure in infancy, but only the mother reported witnessing that event, so it is unclear. She had been telling different stories to doctors. She was convinced her son had multiple disorders and had told him he would die at any time. He received a Make-A-Wish Foundation trip and donations. He was removed from her custody and taken off most medications. Within a few weeks, he was out of the wheelchair, playing basketball, no longer requiring oxygen, very talkative and friendly, and without behavioral problems. He did have a significant intellectual disability, but it was impossible to determine whether this was organic or the result of long-term exposure to multiple medications. With appropriate therapy and a stable home, he could continue to make progress. Story 8. I am a physical therapist. A working mother came into the clinic with her infant in a stroller. She was limping as if she had a nail in her foot, wincing and with tears in her eyes. She cried during her visit with the physical therapist. None of us thought she was faking it. She limped out of the clinic. I glanced out the window and saw her bounding down the sidewalk, hips swaying, full stride, heading somewhere. We were all fools. Story 9. Whenever we had children, usually teenagers, exaggerating their symptoms to extend their hospital stay, we encouraged a healthy routine. Lights out at 9, no screens for 2 hours before bedtime, a diet packed with fruits and vegetables, and a minimum number of laps around the unit each day for exercise. They recovered much faster with these measures. Story 10. My brother was an emergency medical technician for 2 years, and he told me that people would try to use the ambulance as transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the lead emergency medical technician was feeling mischievous and knew the person was faking, he would say something like, "It's odd that he is having seizures but not urinating." Apparently the person would snap out of it for a moment, consider the consequences, then either urinate or stop faking. I thought that was hilarious. Story 11. Along the same lines, while working at a pharmacy, we saw a man come in to try to get a refill on a prescription that had no refills. After pleading that his ear really hurt, we told him again that we could not refill it. One of the other employees saw him step into a side hallway, take a pencil, and jam it forcefully into his ear repeatedly, drawing blood. He calmly left for the emergency room and returned a few hours later with a prescription for pain medication. Story 12. This patient presented with back pain and weakness of the legs. They underwent a full workup including magnetic resonance imaging, standard blood tests, and additional immunological testing to evaluate for conditions such as myasthenia gravis. There was no neurological or immunological explanation for the weakness. Physical therapists felt the patient was intentionally limiting effort. I went to see the patient at the end of the day and prepared them for discharge. The patient was infuriated about being discharged, shouting that they were not better and expressing disappointment in the institution. One comment still stands out 3 to 4 years later. The patient said they could not believe they were being sent home already, that they had not even told their family they were here, and now they would be sent home before the family had a chance to see them. My attending physician and I left the room to arrange things with the nurses. When we returned, the patient was out of bed and standing in the middle of the room, miraculously able to walk without assistance despite having had great difficulty even with assistance over the previous 2 days. At that point, the patient became enraged, accusing us of entering the room without knocking. The patient was discharged home after a discussion regarding abuse of medical services. Story 13. I had a patient when I was an intern who was feigning blindness. She constantly played on her smartphone, only hurriedly hiding it when someone from the care team entered her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She began to raise her arm too but caught herself halfway through, then dropped her hand back into her lap and pretended to stare off into nothing. Story 14. I am a nurse for an ophthalmologist. A 21-year-old new patient claimed to be completely blind after a sudden, severe glaucoma diagnosis from an unknown previous doctor. He felt his way while walking and kept his eyes rolled back. He said he was a famous YouTube rapper who could no longer make videos or earn a living. I said I had heard of him and excitedly asked him to find his YouTube channel on my phone so I could subscribe. He took my phone, opened the YouTube app, and typed in the search bar. His eyes were back to normal and focused. Story 15. One time my roommate, who is an intensive care unit nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down, acting hurt. He started screaming in pain, swearing, and rolling around while holding his ankle before being helped off the field. He then limped over to where the fans sat and watched the rest of the game, brooding in silence before leaving early. After the game, my roommate said he was going to go over and see if there was anything he could do to help, until he saw that the man was limping on the wrong leg. Story 16. A fellow nurse I used to work with on the psychiatric floor told me this story. It was not unusual for psychiatric patients to stash things in various orifices. One woman was convinced she had been impregnated by a ghost-like figure, but no one believed her. One day she began complaining of severe pelvic and uterine pain. She called them contractions. The doctor went to perform an exam. He felt something large and they prepared a table to remove the object, which turned out to be quite large. The third-year medical student assisting with the procedure began hearing the woman complain and shout, "Should I push? I'm going to start pushing." The doctor tried to use the forceps carefully to avoid injuring her. Finally, he said, "Got it," and pulled out the object, the head of a baby doll. The medical student went pale, lost his balance, and nearly fainted. I was told he did not live that down for the rest of the rotation. Story 17. I am not a doctor, but I am a midwife based in the United Kingdom. I had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was that no one had ever seen her actively bleeding. She would call saying she had bled in the toilet but had flushed it. All the examinations we performed were essentially normal, with mostly no evidence of any bleeding. On occasions during speculum examinations, we would see the smallest amount of blood. During a shift, she called again to say she was bleeding. When I walked into her room, I found her jabbing at her vagina with a sharp object to make herself bleed. She had been doing this throughout the pregnancy. Her reason was that she had 5 noisy children at home, needed some rest, and knew we would not admit her to hospital unless there was a good reason. She would do it any time the possibility of discharge was mentioned. We completed a referral to the perinatal mental health team and consulted with safeguarding midwives because she was putting herself and the baby at risk of serious harm. Edit. This received more attention than I expected. There have been many questions about contraception and her parenting, so I will add an update. This patient was not someone seeking social benefits. She and her family were hardworking and loving, and they had full-time jobs. She had been scheduled for tubal ligation but discovered a week before the procedure that she was pregnant with this baby. She could not cope during the pregnancy and became very mentally unwell. She did not realize the implications or the fact that she was causing significant harm to herself and her baby. The perinatal mental health team treated her for psychosis and provided extensive follow-up after the birth. She had a cesarean section and underwent sterilization at the same time, at her request. By all accounts, she is doing very well now. Also, thank you very much for the silver. Story 18. Ophthalmology technician. People pretend to be blind all the time. I go to check their eye pressure with the tonopen, a device that touches the eye, and they say, "What the fuck is that thing?" Story 19. I am not a doctor. I am a nurse. We had a man who had to come in every 3 months to get a medical certificate stating he could not work at his retail job because of severe, disabling back pain. He was receiving large insurance payments for this condition. After the doctor completed his usual examination and questions and signed the certificate, the man asked the doctor to check his shoulder. The doctor examined it and asked how he had injured it. The man said he played rugby for a competitive team. Really? The doctor asked. How long have you been playing for them? The man said he had been playing and training the whole time. The doctor recorded this information on the insurance form. The doctor lost his temper in the staff room, laughing. The next week, the patient lost his temper in reception because his insurance had been canceled. Story 20. A man came to the emergency room when I was a nurse for a stomachache. When I asked about his history, he mentioned a fight with his girlfriend. She left in a tizzy and he fell asleep on the couch. 20 minutes later, the computed tomography scan showed a satellite cable remote wrapped in a condom lodged in his rectum. I supposed he intended to frame her. I did not hear the conversation with the doctor, but I wondered how he would explain why she had wrapped it in a condom. Story 21. I am a nurse but not a doctor. I had a patient who worked in a hospital as a janitor, so he knew enough to fake a bit. He was seeking pain medication and complaining of chest pain because he wanted morphine. He was worked up for all cardiac causes and was fine. Then he claimed gastrointestinal discomfort when he was being discharged, and he was cleared again. He faked chest pain again and was cleared again. Now he is my patient. I am a new face. He tells me he is having abdominal pain. I call the doctor, knowing this patient's history. The doctor says he will be up to see him soon. The patient asks for ginger ale for stomach discomfort. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. The patient had defecated in a basin and then poured the ginger ale over it and tried to tell her he had vomited feces. He obviously wanted dilaudid right away for the pain. I walked into his room and found a pile of feces in a puddle of ginger ale. I told him I would have to take away his food and drinks and that we would need to place a nasogastric tube. Suddenly he changed his tune and admitted to faking it. Why do people do what they do? In this story, it was to obtain opioid pain medication. Story 22. I am an emergency room nurse. I brought a patient back to a room who said he had kidney stones. I asked him to stop at the bathroom to provide a urine sample. He came out holding a specimen cup that contained a piece of concrete. I looked him in the eye expecting a joke. He was serious. I threw it away and walked him back to the waiting room to reflect on his decision. Story 23. When I was a medical student, I worked in the pediatric side of the emergency department, and we gave popsicles to all the children. One afternoon, an 8-year-old came in with his father, and I asked what was wrong. The boy could not remember what he had complained about to his father, and the father could not remember why he had brought him in. The boy's mother was a nurse working at another hospital at the time, and she was the one who would keep track of these things. After a few minutes of trying to figure out what was going on, the boy asked, "So, can I have my popsicle now?" He was completely healthy. Unfortunately, we reinforced bad behavior, and both the boy and his father left with popsicles. Story 24. My cousin got glasses. Her 7-year-old sister wanted glasses too because she thought they looked cool. She began telling her teachers she could not read the chalkboard. At home, she squinted and sat very close to the television, saying she could not see clearly. Her parents became worried and took her to the doctor. She read everything wrong on the vision test, and everyone thought she needed glasses. The doctor was concerned because the test results suggested very strong lenses, which is unusual without a family history of vision problems. Her parents had perfect vision and her sister only had astigmatism, so they realized she was faking it. The doctor told her parents, in front of her, that she would need major eye surgery to see without glasses. They even wheeled in a machine to make it seem convincing that the operation could be done immediately. She panicked, confessed that she had been faking it, and began to cry. She was grounded for a while. Story 25. Years ago I had a patient who had been rear-ended in an automobile accident a few weeks before I saw her. She had a history of lupus. She adopted an I am crippled persona and wore crutches, a neck brace, elbow braces, wrist braces, and knee braces and could barely walk. I saw her a few times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event on the main thoroughfare. I apparently drove through her neighborhood, and to my surprise she was power walking down the sidewalk in old lady spandex, holding weights in both hands. I did not call out to her. The next week she was back in clinic wearing her I am crippled getup again. A few weeks later I received a subpoena for a deposition, and it all became clear. Story 26. I am a surgery resident. When I was on my trauma rotation, a patient was brought in after a motor vehicle collision because there was concern he might have had a seizure that caused the accident. In the trauma bay, he began shaking. The trauma nurse said, "Oh, this isn't a real seizure." The patient stopped shaking, sat up, turned to the nurse, and yelled, "You don't know a fucking thing about me." Story 27. I am an audiologist, a hearing specialist. I have worked in the private sector on legal claims, and with the Department of Veterans Affairs handling veterans' claims of hearing loss. With those two populations, people faking hearing loss is common. For me, the hearing test begins when I call the patient's name from the waiting room. I call them in a normal voice. If they answer, I already know their hearing is normal or no worse than a mild loss. That was the case with this man. He answered and came in, and we had a normal conversation. Case history completed, time to test. I gave instructions over the headphones at a reasonable 50 decibels. Raise your hand when you hear the tone. A 50 decibel tone should be easy and clear, but he did not raise his hand. I increased the level repeatedly. Finally, I delivered a 100 decibel tone in his ear. He flinched from the pain because it was so loud, but he still did not raise his hand to indicate he heard the tone. Even after I re-instructed him, I immediately knew what I was dealing with. I have taught entire classes on how to spot and estimate true results from people attempting to fake hearing loss. Long story short, I wrote a damning report outlining all his inconsistencies and faking behaviors. What made this case so memorable was that we had such a pleasant conversation before. He was a fire chief. I have firefighters in my family. It was one of those encounters where you think that if it were not for the professional distance, we could be friends. But this man was determined to obtain a disability rating, and that angered me. I have other stories if anyone is interested, but this comment will likely be buried. Story 28. I'm not a doctor, but I was in the emergency room one night when a drug-seeking patient acted as if in pain only when staff were nearby. You know those videos where a small child is fine until they see a parent, then cry, and stop as soon as the parent is out of view? It was exactly like that. The person sat quietly with no movement, wincing, or sound, then wailed when a nurse was nearby and returned to being fine when the nurse left. Story 29. Fourth-year medical student. During my emergency room rotation, a trauma patient arrived who had been arrested. During transport, the patient banged her head against the police car window 4 times and then became unresponsive. She arrived with a forehead bruise and remained unresponsive. We all suspected deception, but the patient was a convincing actor. She did not even flinch during the digital rectal examination, which is standard for all trauma bay patients. Some nurses reported that they caught her peeking at the staff when we left the room. We obtained a computed tomography scan, which was normal, and were even considering intubation to secure her airway when our attending walked over, opened her eyelids, and told her to wake up. She then tried to force her eyes closed, revealing the deception. The doctor called her out, and she began screaming at us. She had been much more pleasant while pretending to have a brain injury. Story 30. I am not a doctor, but a nurse. I once read a specialist consultation report, and at the end the diagnosis given was a fictitious ailment. Story 31. When I worked in an intensive care unit, I had a patient who was sedated and on a ventilator. A person claiming to be a family member showed up out of nowhere and stayed day and night. I became suspicious because they were clearly lying about knowing the patient. I asked about the patient's recent birthday, since they had said they celebrated it a week or so before falling ill. They said it had been a wonderful party, and I replied that the patient's birthday had not yet occurred and would not for months. When security arrived, it turned out to be a homeless person who had sneaked in, found a room with a sedated patient, and decided to make it a place to stay. Needless to say, security controlling access to the intensive care unit was completely inadequate. Story 32. An inmate presented with signs and symptoms of a major stroke. At that time, the protocol was to obtain a non-contrast head computed tomography scan to rule out bleeding and then administer tissue plasminogen activator, a powerful clot-busting drug that is only worth the risk if it can reduce serious disability. He later began embellishing symptoms that did not match the diagnosis, which is how we determined he was faking to get time away from jail. Story 33. My mother was an emergency room nurse. Years ago, they brought a prisoner from the local penitentiary who appeared unconscious. The guards suspected he was faking it. They checked his vital signs and everything seemed to be okay. The attending doctor poked his foot with something pointy. There was no response. Then the doctor had an idea. They took a rubber hose and inserted it into the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Yes, sternum rub, got it. Story 34. Frame test is important. A bear is in quicksand, waiting for a soup dinner and a spoon. Story 35. Not me, but I know an army doctor who advised everyone with cold symptoms or sore legs to stay in bed for the whole day. The next day, half as many people with symptoms showed up. Story 36. My emergency medical technician instructor told me that he and his crew responded to a seizure call. They arrived to find the door wide open and a female patient unconscious and completely naked. They began assessing her while one crew member cleared the house to make sure no one else was inside and to find something to cover her. After performing an arm drop test and checking her pupils, they concluded she was feigning the illness. Their policy was never to state that openly but to treat the situation as if it were real. In keeping with that, he called for an ambulance to take her to the hospital. When one crew member said to the captain, "She is clearly faking it," the woman, who was supposed to be unresponsive, said, "No, I am not." Story 37. When I was a kid, I learned I could pretend to be sick and get out of school. 1 or 2 days a week, I would fake a migraine, hold my head, and complain so I could go home. Eventually, my parents took me to a neurologist who suggested they should not let me eat chocolate and sugar. I admitted to faking and was grounded for a long time. Story 38. A patient presented to the emergency department with a chief complaint of dental pain and reported allergies to every known nonsteroidal anti-inflammatory drug. I am aware this can be genuine, such as in aspirin-exacerbated respiratory disease. This is a small rural hospital. I saw the man walk across the hall to the lounge, help himself to a large mug of hot black hospital coffee, and drink it in the waiting area. When asked about the dental pain, he reported it was severe and aggravated by cold or hot liquids. Head and neck examination revealed no acute findings. He was discharged home with instructions for supportive care, including ice packs, and to follow up with his dentist as soon as possible. He expressed his dissatisfaction loudly and with salty language. Story 39. After I finished writing a note to stay home from school, I turned to face them and saw father and his son wink. That's pretty much it. Faking it is a hard call to make in general. Story 40. When I was a kid, I planned my sick days way ahead of time. I had an old thermos where I poured leftover milk and meat scraps and left it on the windowsill in my bedroom to fester for a month. I set an alarm for the middle of the night, dumped the contents on my rug, and ran to tell my dad I was vomiting and very sick. The contents filled the whole condo with a horrible smell. And when we tried to clean the rug, both my dad and I ended up vomiting in the tub. He had to take the day off work. Needless to say, I never did that again. Story 41. When I was a kid, I used to fake being sick simply because I wanted to stay home and spend time with my grandpa. He knew exactly what I was doing and 90% of the time made me go to school. We lived with him. Every so often, though, he would wink at me, and we would convince my mom I was feverish, then spend the day together watching movies and being buddies. I was about 9 or 10. I cherish those days because he passed away when I was 19 and I am now 31. I would give anything for one more of those days. Story 42. My mother is an emergency room nurse, and she said that once a woman came in complaining that she had the whooping cough. Whenever she coughed, she followed it with a loud whoop. Story 43. Not a doctor. I was an emergency medical technician and had a frequent flyer who rotated through various chief complaints, one of which was complete blindness, truly complete. We did our duty, got him on board, took his vital signs, and transported him to the nearest hospital while providing basic life support. We occasionally had a bit of fun with him. On one blindness call, we noted he walked a narrow, winding path from his trailer to our ambulance without difficulty. Once on board, when asked for his insurance card, he rifled through his wallet and pulled it from a mass of cards without problem. When asked direct questions, he met our gaze and followed it when we turned our heads. When I pointed this out, he quickly looked over my shoulder and said, "No, I'm blind." "Okay, our mistake then. Off we go." Story 44. I am not a doctor, but here's a funny story from work a couple of years ago. A man called in sick for about 8 days, saying on the phone that he was very ill. He returned to work the following week, noticeably tanned. He gave the manager a medical note written in Spanish that bore an official seal from a Cuban clinic. He walked over with a grin and said, "Yeah, I'm probably fired." He was fired. Story 45. A 30-year-old woman came to the emergency department with excruciating abdominal pain. She said she felt paralyzed, complained that it hurt when the physician pressed her abdomen, and demanded oxycodone immediately. The emergency department physician said that if she could get out of the bed and do 20 jumping jacks, they would give her oxycodone. She did 20 jumping jacks and was then discharged from the emergency department. Story 46. I am an emergency medicine physician. Many weak pseudo-seizure stories in this thread are fairly common. Some people are intentionally seeking intravenous benzodiazepines, but most have seizure disorders with psychiatric issues and are not trying to deceive us. They are sad, confused people who do not know how to handle stress. I have seen all sorts of people faking symptoms. The most devious was a man I will call Steve. He worked in the medical field, probably as a nurse or technician. He was tall and thin. He claimed to have Marfan syndrome, a rare connective tissue disorder that produces a tall, thin habitus and increases the risk of aortic dissection. An aortic dissection occurs when the aorta begins to tear and is life-threatening. He not only claimed to have Marfan syndrome, but also said he had a prior dissection treated by a surgeon at a medical center. He presented with a classic dissection story: tearing chest pain radiating to the back. Steve took it further. He would flex one arm when the blood pressure cuff was on that arm and relax the other arm. This produced markedly different blood pressure readings between arms, a classically taught finding in dissection. He also claimed to have an anaphylactic reaction to contrast dye to force pretreatment with diphenhydramine and corticosteroids, which delayed imaging by about 8 hours. During that time, he repeatedly requested opioid analgesics and became nauseated, requesting promethazine. For those who do not know, intravenous hydromorphone, promethazine, and diphenhydramine potentiate each other and produce significant sedation. They are highly sought after by people with opioid dependence. I saw Steve on his 3rd visit. The 2 prior computed tomography angiographies showed no dissection. He was unwise enough to come during normal business hours, and I contacted the surgeon he named. The surgeon said he had never cared for the man and had received multiple calls about him. I still offered the computed tomography angiography but told the patient he would receive no opioid analgesics. He left angrily. No one has seen him since. I suspect he moved on to another hospital. Story 47. I'm a nurse. I work in acute rehabilitation, Patients come to us for physical therapy and to recover from surgeries or illnesses. I had a patient who deceived us. This man was medically ready to go home but very anxious. He repeatedly asked me to recheck his vital signs and blood glucose and raised new concerns like a twitching hand, dizziness, or blurry vision. I thought I was able to rule out his concerns and calm him. One day I checked his vitals and his pulse was low, about 48 beats per minute. Everything else looked okay, so I planned to recheck in a few minutes. When I returned, he appeared worse. The pulse remained low, his oxygen saturation was low, and he was woozy and slow to respond. I brought in my charge nurse and we became worried about an opioid overdose. We called the medical doctor, gave naloxone, and contacted emergency medical services. His breathing became slower and shallower while we discussed this. Emergency responders arrived and he was nearly unresponsive, barely reacting to sternal rub. They administered more naloxone with no effect, so we considered stroke. He had a slight droop on one side of his mouth. Had it always been there? I feared I had missed something. I gave report and they rushed him to the hospital, where he underwent a thorough workup because he was high risk for many issues. We followed up the next day and nothing was wrong. The patient apparently heard me mention his pulse and decided to take advantage. He may have held his breath during the oxygen saturation measurement and lowered his mouth when we mentioned stroke. He probably skipped lunch because his blood glucose was low. He did it to avoid going home. He is now banned from our facility. Story 48. A few years ago, I disliked my boss, so I would fake migraines and headaches that were too severe to go into work. After seeing the same doctor a few times, he referred me for a magnetic resonance imaging brain scan. I went along with it. 3 hours later, I was rushed to the emergency department at my local hospital because I had 2 aneurysms in the lower part of my brain. I had been faking those headaches. Turned out to be a blessing in disguise, I suppose. Story 49. Former scrub nurse. The patient was on the table undergoing a minimally invasive procedure, repeatedly asking for more midazolam and fentanyl. She had already reached the maximum safe dose and appeared tolerant, despite claiming she had never received narcotics before. Suddenly, she began yelling, "I see the light! I see the light! Does anyone else in here see that light?" A 6'4" circulating nurse, a mountain of a man, stepped in front of her and said, "No, and neither do you. Now be quiet and let us do our job." The patient remained calm with normal vital signs and was resting comfortably. Story 50. I am not a doctor. I am a nurse. Once I had a patient who appeared to be having a seizure. The other emergency room nurse and I knew she was faking it, and he said as much. She suddenly stopped, looked straight at him, and yelled, "Shut up, fat boy." We both laughed so hard. She was called Fat Boy for a few months after that. At least she was not actually having a seizure. Story 51. A patient and a family member came in stating that the patient has epilepsy and needs benzodiazepines. While I was gathering the history, the patient began to have a seizure, rolling on the ground with head shaking and feet kicking. I asked whether he needed help. He replied that he was experiencing a seizure. The family member attempted to convince me that the patient has daily seizures and needed benzodiazepines. I explained that these appeared to be psychogenic non-epileptic seizures and recommended evaluation by a psychologist. They had difficulty accepting this and left. Story 52. A woman brought in a kidney stone she had passed and said she was in agony from another stone. She escalated the analgesic ladder until she was on opioids, most likely pethidine. All her scans came back negative, and we had the stone she brought in analyzed. Came back as quartz, a mineral that does not occur in the body. When confronted with this fact, she left quickly. 6 months later, after I had rotated to another nearby hospital, a woman came in with abdominal pain and I went to see her. We locked eyes and instantly recognized each other. I said nothing, but she knew she had been found out and discharged herself. Story 53. I am an intensive care unit and emergency room nurse. We see a lot of malingering in the emergency room. One day, a frequent patient came in and began pretending to have a seizure during triage. I knew this woman. She had faked seizures many times before. This time it was in the lobby in front of about 30 people who had no way of knowing it was not real. She was rolling around on the floor, making a fool of herself, and people looked horrified. I walked up to her and said calmly, "Karen, what are you doing?" She replied, "I'm seizing." I told her to stop seizing. She did. Her name was not actually Karen. I used that name for confidentiality. Story 54. My mom had been complaining all day about abdominal pain, continued to get worse, so my dad and I drove her to the emergency room. When we arrived at the entrance, she let out the loudest fart. She was not faking the pain, but it was funny. Story 55. I work in occupational health. I am an athletic trainer, not a doctor. A man came in complaining of back pain. He hobbled into my office, walking 1 inch at a time and groaning. I suspected he was faking it when he howled in pain after I barely touched 10 different areas on his back. I looked out the window and saw about a dozen baby turtles crossing the road. I called him to come look. He jumped off the massage table and sprinted over in awe of the baby turtles. I told him to get back to work. Story 56. I am a resident, not a psychiatry resident. This occurred during my psychiatry rotation in medical school. There was a patient at an inpatient psychiatric facility for suicidal ideation. She repeatedly insisted she had a mass in her breasts and demanded to be physically examined only by male physicians. When the supervising psychiatrist declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined to perform the exam, but I had a hunch to check her medical records. An ultrasound performed a week earlier showed only normal breast tissue without masses. Apparently she had frequented many physicians' offices with various nonspecific complaints and would usually focus on breast or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. Her primary goal appeared to be attention from medical professionals, although we also had to be careful that she was not seeking grounds for a lawsuit. Patients like her are why physicians document everything meticulously. The patient would not admit to fabricating her symptoms. According to the supervising psychiatrist, she did not actually believe any of her health problems existed. Her primary goal was attention from medical professionals. If she had truly believed she was ill, we would have diagnosed illness anxiety disorder, commonly known as hypochondria. Story 57. Here is the opposite scenario. I went to the emergency department for the second time. I had severe abdominal pain that I could not identify. The nurse casually offered me oxycodone and looked really surprised when I declined, saying it would not fix the pain. They seemed to expect that I would say that taking it was the reason I was there. Story 58. I am not a doctor. I work in medicine. I saw someone come into the emergency department after throwing themselves down the stairs to obtain opioids. Miraculously, they were fine except that they badly injured one of their knees. We offered them physical therapy and a knee brace. They were extremely unhappy. Story 59. I always had a hard time lying, probably due to being on the autism spectrum. When I wanted to get out of school as a child, I would hit myself in the stomach with my fist so I would not be lying about having a stomachache and wanting to go home. Looking back, they must have thought I was a victim of horrific bullying, but nobody ever said anything about the bruises. This is horrible in many ways. Story 60. No abnormality detected. I heard a story about a local prisoner who came in complaining of sharp abdominal pain. He claimed he had swallowed a nail. Radiographs appeared to show a small nail lodged in his body. Turned out he had taped it to his back. He was not trying to trick the doctor. He apparently just needed some fresh air. Story 61. I'm not a doctor, but I am a nurse. There was an elderly patient who frequently used the call bell because she wanted attention. She always needed very basic tasks done for her because she treated the place like a hotel. It was a rehabilitation ward, and we were trying to encourage patients to do as much for themselves as possible. She would ring the bell for things like, "Please lift the blanket for me," "Please pass me my phone," or "Please feed me." Claiming her hands did not work, I caught her several times lifting herself off the bed with her hands and grabbing her phone when it rang. After days of telling her no and that she needed to start doing things for herself, She became more and more frustrated. Eventually she snapped, grabbed me by my collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I did not know what to tell her. I just looked at her and blinked as she slowly released her death grip on me. I guess I healed her hands. Praise the Lord. One upvote equals one prayer for an old lady's arthritis. Story 62. I saw some truly terrible Munchausen by proxy cases. A young teenager was extremely germophobic and had severe obsessive-compulsive tendencies. He was very paranoid and constantly believed he was ill. It turned out his mother was not only encouraging this but actively shaping it. She imposed excessive discipline when his room was not spotless and subjected him to scalding baths. He was not necessarily faking symptoms, but he was not actually sick. He was a victim of a severely disturbed mother. Story 63. When I was in prison, there was a guy who wanted to go to the medical unit because it wasn't as strict as a regular unit. He told the doctors he felt like he was having a heart attack. They called a medical emergency. People rushed into the unit and we were locked down. He pretended to fall on the ground. The prison doctor strolled in, not hurried at all. He went over to the man lying on the ground, put his fingers on his neck, and said, "I can't feel a pulse." The guards looked scared. The doctor opened his bag, took out his clipboard, tapped on it and made other noises, and yelled, "I'm going to shock him." The man immediately sat up and started to fake gasps. I think he was holding his breath. The doctor said, "Fucking idiot. Put him in segregation on suicide watch and make sure he's being checked in his cell." Just to be clear, suicide watch is awful. You get absolutely nothing in your cell except a jumpsuit made of rip-resistant fabric. He was there for 2 weeks and didn't try anything like that again. Story 64. I am a doctor. I used to tell stories about cases like this, but lately I have come to realize that many people who feign symptoms have severe psychological trauma, for example child sexual abuse, which manifests as physical symptoms or another serious underlying cause, for their factitious disorder. Even malingerers are usually in a terrible place in life, despite the sensational interest in their stories. We should treat both types of patients with compassion and try to understand the circumstances that brought them to that point in life. I once treated a patient who nearly died after injecting fecal material into her skin. That case was extreme. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.